Next comes to the pharynx or the throat chapter. You should understand this pharynx is a junction of the respiratory tract and the GI tract. So even this question was asked in CPC, which particular organ acts as a common part for both the GI and the respiratory tract, which is a pharynx or the throat. We have something called like branchial cleft cyst, or it's like pharyngeal arches. So these are the embryological remnants. What happens? Embryological remnants remain patent. So the patient comes for excision of these pharyngeal cleft cysts. So we have a specific code. So what are these tonsils finally? Tonsil is a lymphoid tissue. You know very well it acts as a defense mechanism. So whichever microorganisms enter, the children especially develop tonsillitis often because of the pathogenic organisms entering the oral cavity, and the allopathic treatment would be to remove it, which is tonsillectomy. Same way, there is also a tonsil in the nasopharynx called as adenoid. So it's also known as a nasopharyngeal tonsil, which is nothing but the lymphoid tissue that helps in the immunological mechanism. When there is hypertrophy of the tonsil, be it the adenoid or the oropharyngeal tonsil, what happens? The physician resorts to do the removal procedure called as a tonsillectomy. You need to understand two things here. When the physician is planning to do a tonsillectomy or an adenoidectomy, or just an adenoidectomy or a tonsillectomy alone, we have codes based on the age of the patient. If it is less than 12 years, we have a code. 12 and 12 plus, like 13 or 60, whatever it is, we have a specific code. And you need to know whether it is primary or secondary. Is the procedure being done the first time or is it being done at the second time? Please select the code based on the age of the patient plus whether it is the first time or the second time they are doing it. What are tonsillar tags? After the tonsillectomy, what happens? The remnants of the tonsils are called as the tonsillar tags. Now the patient comes for removal of these tonsillar tags due to some complications. By the way, you know what is an ostomy? An ostomy means an artificial opening. So an opening into the pharynx is a pharyngostomy.